Good day everyone. So in this next class we are going to discuss about the topic electric shock. So what is the definition of shock? So when there is a sudden flow or any cessation of the variation in the current which is passing through a body, there will be a painful stimulation of a sensory nerves. So that is called as a shock. So what are the causes of shock? So there may be any poor communication between the therapist and patient, or the equipment is poorly designed, or the equipment is not properly handled. It can, suppose if it is handled in a mishandling in a way, or if it is a poor installation of the equipments. So these are the causes of the shock. Next, safety precaution of shock. So every student must have the motto, you should not harm any patient, and if there is an electrotherapy department set up, a fire extinguisher is must needed. And in direct or uniphasic current, it can also cause a electrochemical damage that will lead to chemical burns. Why? Because in direct or uniphase current, the electrons will be transferring from the one form of unidirectional directions. There is a transfer of positive electrons and negative electrons. So in one single directions, there may be a chances of the development of the electrochemical damage. So that will lead to a chemical burns. And another factor is, if there is a large current which pass through the skin, that may also lead to a shock in terms of burns. And then currents of sufficient amplitude, it may also cause a heating of tissue and it will lead to a erythema. And another one, if there is not a proper frequency setup, that will stimulate a nerve or muscle which will damage by provoking the muscular contractions. Yes. What are the types of shock? So there are two types of shock, macro shock and micro shock. In macro shock, the current which is directly passed through the skin, and in micro shock, it is a very small current which are applied directly. So for example, it is a pacemaker to the heart. And depending upon the nature and amount of current flow, macro shock, micro shock and earth shock, and depending upon the severity of this shock, mild shock and severe shock. Yes, in macro shock, what will happen? It occurs when the current passes between the two contact points of the skin. So if the voltage value is less than 200 mu, the human skin will provide the resistance. But if suppose the value is above 450 to 600 V, there will be a breakdown of the skin occurs. So these all will happen under the macro shock. In micro shock, if the electrical circuit is established by the electrodes is introduced in the body by passing the skin, that is known as the micro shock. So in this, if the current only 10 MUA, it can be sufficient to cause the fibrillation in this case. And then based on the severity of shock, in mild electric shock, there won't be any damage to the body structure or function. But in moderate time, there will be a development of the hypotension because of the vasodilatation after the electric shock, and it also make the patient to lead to the unconsciousness. But in severe case, there will be a termination of the respiration and the heart function. Next heading is earth shock. So when a person comes in contact with a live wire and earth together, that may develop as a earth shock. So earth is a very good conductor of the electricity. So from the live wire, the current will be enter into the body, and that from the enter to the earth. So it will receive the earth shock. So what are the precautions you have to take against the earth shock? So the department should be designed in a proper way. There should be no chances of the earth shock, and the floor, it should not be wet, and the floor should be of insulating material. If not, a carpet should be spread to avoid direct contact into the earth. And even on the floor, you should made of the insulating material, and the care should be taken that water should not leak through the crack in tiles to make an earth connection. And the physiotherapist and the patient should wear the proper shoes, slippers to avoid the direct connections of the body with the earth. And the switches must be in the electrical line for each modality. It should not break the live wire. And then, so what are the management of the electrical shocks? So you have to examine the patients completely, including their traumatic injuries, and you have to check for the registration, and you also check for the anesthesia and any wound care, and you have to check for the arrhythmia, chest pain, and any suggestion of cardiac damage, pregnancy and known heart diseases. Yes. So in addition to the burn injury, the alternating, if the patient is affected by alternating current, it going to affect the patient hand to the current source. but in direct current it is going to throw away the patient, causing the severe injury. Although if there is any skin burn, if there is a skin burn severity, but it does not predict the degree of the internal damage, okay. But if the skin has a lower resistance, the internal damage will be more severe. And then if the patient is suspected as any burn injury, you have to inform to a burn unit so that they will begin the fluid resuscitation. And then, so what are the precautions still you can take to prevent the electrical shocks? So you should not use the equipments with the damaged insulations, and power cords should be doubly insulated always and should be replaced if the outer layer is damaged. And extension cords in an electrotherapy setup is only for the temporary use. So for extended use, we have to use a new outlet, as the cords are easily framed. If not properly, it can also cause a trip hazard. Yes, what are the prevention of electrical hazards? So you have to be very focused on your workplace should be like very safe work practices, and you have to protect every electrical equipments, and you have to check for the insulation, and you have to check for the guarding and grounding. So these are the things will prevent from the electrical hazards. And then power cords overloaded in a power strip, all of the currents turn should flow through a single cord only, and you have to ensure that the water and electricity in the electrical department should be in a proper way, because these if it is located in a particular way, it can protect to minimize the shock hazards. So wash basin should be located away from the electrical devices, and outlet within 6 feet of the sink or other, to minimize the shock hazards. Yes. So what are the differences between the electrical shock which is caused by the direct current versus the alternating current? So if the electric shock is caused by a direct current, the person may feel at least 5 mA of a direct current, and in this direct current, the fibrillation that will lead to a cardiac arrest at the rate of 300 to 500 milliampere. In this, the severity will be the less severe. But in alternating current, the person may feel the 60 Hertz, and the damage of fibrillation which leads to cardiac arrest will be of 60 milliampere, and the severity will be more severe as that of the intensity of the current. And in severity of the shock. So the greater the current passes through the body, the more severe is the shock. Then what are the factors which determining the severity of the electrical shock? So type of current, it is going to determine the severity of the electrical shock, the amount of current, duration of current, strength area of current, and electrical field strength, and the pathway of the electricity through the body, and overall health of the person. So these are the factors it is going to determine the severity of the electrical shock. Yes. Then what are the effects of shock? If a person undergone a very minor shock, they will be frightened, they will be distressed, and there will be no loss of consciousness. But if they are falling in extreme cases, there will be cessation of their respiration, cardiac arrest, and even there is no cardiac carotid pulse and fully dilated pupils. But if there is a severe shock, they will fall in the BP and there is a loss of consciousness. So what are the signs and symptoms? Burns. So if eating is due to a resistance, it may cause a deep burns, and the voltage level of 500 to 1000 volts, it will cause the internal burns due to the larger energy. And then next symptom is ventricular fibrillation. So electrical shock can cause the fibrillation, and fibrillation it should be treated very immediately treated by the defibrillators. If it is not, then it may prove as a lethal. So death even caused by electrical shock is called as the electrocution. What are the neurological effects? So anyhow, it going to affect the nervous system, and repeated and severe electrical shock does not lead to death. It's shown to cause the neuropathy. And also in neurological effects, there may be a signs of numbness, tingling, and there will be change in vision, speech, and there will be alteration in the sensation. It also occur in the neurological effects. And in muscular effects, there will be a muscle spasm or contraction, sudden immobility or fractures, or any body part may look deformed. And other fatal complications including interrupted breathing, irregular heartbeats, chest pain, seizures, and unconsciousness. Okay, so what is the self-care will be given for the shock patient? So you should not touch the person until the power is shut off. So if the source is a low voltage current, remove the fuse or switch off the circuit. So if there is no switch in the circuit, use a board or wooden stick, rope to get the person away from the source. But do not touch the victim in your hand. So until it is necessary, do not move the person. He or she could have the dramatic injury, especially to the head or neck. And you have to check for the burns. So cover the burn areas with dry sterile dressings, and after the minor shock, allow the person to get dressed and give something to them to drink to prevent the hypovolemia. Because of the vasodilatation, the blood pressure will get lower. And hot fluids must not be given to drink. It will further lead to vasodilatation and further fall in the BP. And tightening clothing should be loosened and plenty of air should be allowed. Fans should be switched on and windows should be opened. Excessive heat will increase the metabolism in the tissue and oxygen demand will increase. So if the victim, suppose in case it is stopped breathing, you have to go for the artificial respiration either manually or with the ampu bag with the electrode. So you should not give an artificial respiration if the patient is breathing naturally. So oxygen therapy, sometimes it may be useful in some cases. So if the pulse are absent, the heart may not be functioning. So external cardiac massage must be started without the delay. And if the heart is under the fibrillation, only cardiac massage will not be helpful. For this case, you have to use an instrument called defibrillator. It should be used. And if the patient is awake and there's no problem after an electrical shock, so they can shift it to hospital for the further checkup, and they check for the major case. Medical officers should be called without any delay. And what are the prevention you can take? So all the apparatus should be checked before you are using, and all the connections should be checked before you are using. And before giving the treatment to the patient, you have to check for the frequency and intensity, and the intensity must be in 0. So control should be at 0 before starting the apparatus, and proper warm-up time should be given to the apparatus before starting the treatment. And intensity should be increased gradually. You should not increase the intensity very fast. You have to increase the intensity very gradually. You have to increase the intensity. And while treatment is going on, the patient should not allow to touch the circuit. And all the apparatus should be serviced at the regular intervals by a qualified engineer. And covering of apparatus is very much must. It should be of insulating material, and stay clear of the fallen wires. And do not turn the electrical switches on and off, touch on the electrical appliances while your hands are wet, or while standing in water, or when sitting in bathtub. So whenever you are giving any hydrotherapy or any water related, when you are in that particular wet place, you should not switches on that particular equipment, because that may lead to a shock. So we can prevent that. And you have to replace the burn cords and wiring, and you have to cover all the electrical sockets with the plastic safety caps. And before you do electrical repairs, remove the fuse from the fuse box or switch from the circuit breaker. And then, so when treatment you are giving in the water bath, the container of the water, it should be of insulating material if it is placed on earth or any conducting surface. And the container of the water, it should not leak. Okay, so water should not be added when the current is flowing. So when you start the current, the water, it should not be added extra more. And to make the current earth free, either the current from the batteries should be used, or alternating current, it can be rendered by a static transformer. And patient, he should not he is not allowed to touch any part of the machine while going on the treatment, while during the treatment. So these are the factors, the effects of shock: flash burns, asphyxia, breathing stops, thermal or electric burns from the current, ventricular fibrillation, and cardiac arrest, and involuntary muscle reaction. Yes, last one. The electricity current, the value of the amperes, and then its impact on the people. So if it is a 1 milliampere current, the impact on the people, there will be no sensation. If it is 1 to 3 milliampere, there will be a mild sensation and no pain. If it is a 3 to 15 mA, there will be a pain, but most people can get away. If it is a 15 to 30, there will be a pain, but half of the people will get freeze. If 30 to 75 milliampere, there will be a pain, there will be a breathing difficulty, and there will be asphyxia. If there is a 75 to 200, there will be a possible ventricular fibrillation. And if it is 200 to 300, there will be a certain ventricular fibrillation. And if it is a more than 300 plus, there will be a severe burns and the heart will get stops. So thank you.